So from the doctor's perspective, it allows us to view the patient's scans, CT scans, MRI scans in 3 dimensions with the 3D holograms. It allows us to appreciate the structures and the relationships a lot better compared to a 2-dimensional screen which we use on a computer. And in that way, it translates to, of course, a better explanation and also better communication with the patients and their families as well. Hi, my name is Yujia. I'm the Assistant Group Chief Technology Officer for the National University Health System. Being human in the digital world means recognizing that we are human and we will never be replaced by technology. Technology is there to assist us and to make our lives better, but not to replace us as humans and humanity.
My guest today is Dr. Yujia, Assistant Chief Technology Officer of the National University Health System. Dr. Gao is a pioneering surgeon in holomedicine, where he's using mixed reality in surgery like liver transplants. And he's driving innovation not just in his practice or his hospital, but even internationally.
One of the cases that I always like to cite, and I think really demonstrates the impact of technology like this, is for a very young patient with relapse of tumors in the pelvis. So she has about 7 tumors in the pelvis, and each of these tumor spots are actually less than 1 centimeter. So we can barely make it out on CT scans and MRI scans, and with the naked eye, it will be impossible to see where exactly these tumors are. So if we are not able to pinpoint where the tumors are during the surgery itself, this would potentially have rendered her at a very young age incontinent. She won't be able to control her urine, her bowels, and would have affected her reproductive functions as well. So what we did was that we got the PET scan and then we uploaded it onto our MR device, which is the HoloLens 2, and we generated a 3D hologram at which we can then superimpose or overlay on her during the surgery itself. And this actually allowed us to pinpoint exactly where the 7 spots were, and we were actually able to very accurately remove those 7 tumors. We first started using this technology, the devices. We used to upload the raw images, but I remember the thing that struck us the most was when we used it for a patient who was going for brain surgery. And to her, she actually got a little bit freaked out because the reconstruction of the 3D image was so realistic that essentially it was literally her head looking back at her, because she can see her own face and everything. And that case actually made us realize that what we perceive as a high fidelity, high quality image as doctors and clinicians may not be perceived the same way by the patients. So what we try to do nowadays is to have the patients wear the device so that they can have a look at their own scans. And for example, counseling and consenting for procedures are done in, I guess, a 3-dimensional world rather than a 2-dimensional world. When the internet first came about, everyone was very apprehensive about it. We were worried that it's going to take over the world, it's going to cause a meltdown, the whole Y2K thing, but things turned out fine. Like what the article that you wrote pointed out, a lot of it is about finding the balance, right? Finding the balance between directed and empowering use of the internet, finding the balance between meaning and utility, and also finding the balance between responsibility as well as regulation. Progress with technology is always going to happen, right? We can't stop the progression of technology. Whether or not it's going to bring harm or good, it really depends, perhaps in a very naive way, how we intend to use it and how we intend for people to consume and to accept it. But of course, if we abuse technology, if we abuse the internet, then it will definitely cause harm. But if, let's say, we use it in the proper way, if, let's say, we find the balance between the light and the dark side, if you can put it that way, then of course it's going to bring tremendous amounts of benefits and advantage to us as humans.
We identified 4 characteristics of what it means to be human. Humans as dreamers, humans as storytellers, humans as social and moral beings. And of course, the thing that distinguishes us from bits and bytes is our physical living body. So today we're going to dive into humans as physical beings and how the future of the internet is going to impact us right to our bones.